We've just been dispatched to a 25-year-old, and all the information we've got is that he's fallen out of a tree. So we're approaching the scene now. You can see that the tree is a possible danger. We don't want to hurt ourselves, we're only here to help patients like that. The tree looks stable. There is a sore on the floor, but it is clear of the patient and it's safe for us to enter. You right, team?
Yes.
Cool. You'll approach the patient. Hi, sir.
Hello.
I'm Dana. This is Jordan, my colleague. What's happened to you today?
Fell out of the tree.
All right. So what I can notice is your back stuff, and you're bleeding out of your arm. Are you right if I manage that for you?
Yep.
Cool. Just get my bandages and my saline. We'll use 100 mils of saline per centimetre of wound. So for that approximately 15 centimetre wound, I would use an inch and a half. I would flush the wound with the amount I just said, wet my bandage so it doesn't stick, start applying pressure, and I'm going to start wrapping it around. So this is the most important injury because it's could currently cause the most risk to his life. So first, I'm just getting the bandage on. And when I want to start applying pressure, I can give it a twist to apply more direct pressure to the wound. Stop it bleeding. Right, so can you start doing vitals for me? So a blood pressure and the pulse rate, please. Once I'm at the end, I'll just tuck it under one of my wraps. Just done nice and tight. Can I get you to hold this across your chest just to elevate the wound a little bit? I'm going to start doing a rapid trauma suit to establish any possible other injuries he might have. Do you have any pain anywhere else, sir?
Yeah, my legs sore as in my neck.
Okay, so your neck's sore. So I'm going to start at the cranium, going behind, so taking every bone, facial bones, all tap, jaw. It's fine. I'm going to check my gloves regularly for blood, see if there's any open injuries I can't see.
That's all.
Right, so that's sore. So, because I've established he does have midline tenderness in the C-spine, I'm going to ask you to hold your head still. And Jordan, once you finish that, can you hold his head still for me?
Okay, so his heart rate is 85 and his blood pressure is 100/70.
So slightly higher heart rate, slightly lower blood pressure could indicate that he's compensating for blood loss. So that's something to keep in mind and keep an eye on. I'm going to continue my trauma sweep, check the scapula, clavicles, run down each arm. Tell me if there's any pain, right, sir? Run down this arm. Careful of this hemorrhage here. That's not broken. That's fine. I'm going to go around the other side. Check this arm. Checking for broken bones or any blood. Just going to go onto the ribs now. Down the middle. Can you take a big deep breath in and out? Does that hurt at all?
No.
No, okay, cool. I'm just going to pressure on your tummy now. Tell me if there's any soreness.
No.
No? Cool. Then move down to the pelvis. That's fine. Then move down this leg. Check the femur. Down this here. The foot. That's alright?
Yep.
Check this femur. That's fine.
Up.
Okay, so that's getting sore.
Yep.
How's your foot?
It's okay.
Okay. I'm going to expose the limb here carefully because I'm suspecting a fracture here. And I can see it's angulated and very likely broken. But first I'm going to address the need for a C-spine collar. What is fitting in the criteria of applying this to my patient is, even though he's got a GCS of 15, and have you been drinking today, sir?
No.
No, he's not intoxicated, but because of the mechanism of the injury, he's got midline tenderness, and because he's got distracting injuries, I am going to apply this collar. So when placing a collar, you want to measure it first. I've established that I need to use it. So I'm going to use your 4 fingers from the trapezius muscle to about the jawline. So that's about 4 fingers. I'm going to measure it about there, so it can actually go up 1. To remove it, you do that. And then, okay. Yeah. Actually take it up 1. Click it back in place. Cool. And once you're ready, can I get you to lift his head if you're happy with your hold on it? Cool. This will help stabilise the neck, alright? Move that round like that. Head still up and lift it up, and I'm going to place it up there. How's that, sir? Is that okay?
Yep.
Okay, cool. So now that that's been established, I can see that his wound has started to bleed through the bandaging. So can you please, because his neck is stable, apply this bandage to his leg? While he does that, because I suspect that this leg is broken, I'm going to give him some painkillers. First, I'm going to establish what his pain is or what he perceives it to be. So on a scale of 1 to 10, if 10 is the worst pain you've ever felt, where do you think you'd fall on the scale right now?
Probably like 8.
Okay. Pardon me. Because it's quite a high pain scale or high pain rating, I'm going to give him some short-term pain relief first. Because his pain is quite high on the pain scale rating, I'm going to give him some methoxyflurane and some short-term pain relief. So what I'm going to do, put out the kit. Oh, so have you seen this before?
No.
This is called the green whistle because it's going to help the pain when we move your leg, alright? So I think it's broken again, just go into that pain. So what I want you to do is breathe in and out through this. And it might make you feel lightheaded. Do you have a history of malignant hypothermia in your family?
No.
Do you have kidney problems?
No.
Do you have any allergies to this that you know of?
No.
I can tell he's following instructions. This is 3 mils of Pendrox, expires 12/20, November 2020. Can you check this for me, please?
Yep, Anthrax, 3 mils, and expires 2020.
Okay, cool. So I'm going to get you to take this in your good hand and breathe in and out through it. When there's going to be extra pain from me with this, I'll let you know and you can take more, alright? I'm suspecting I'm going to have to split this, but first I'm going to do some limb baselines. Are you ready if I lift up your pant and take off your socks, sir?
Yep.
Cool, so in reality I'll cut it, but it's uniform. So this one's fine, I'll start with this one. No established pain. We want to assess both limbs. Slowly with this one. Can you take some deep breaths for me, sir? Okay. Yep, and it immediately appears angulated and paler. It is cooler to the touch as well. I'm going to check my cap refill. Can you tell what toe I'm touching?
Big toe.
Yeah. So it's a little bit on the slow side, it's about 4 seconds. What about here?
Big toe.
Yeah. That was about 2 seconds, so the normal rate is about 1 to 4 seconds. I'm going to check for the pedal pulses. And I found it right away. Right, so this one is slightly fainter. I would mark it to make it easier to find next time. I'm also going to check the sensory and motor skill of the limbs. So I've checked the sensory, which toe I'm touching. Can you push up with your foot? Good, and down with this one. Losing my voice. And up with this one. And down with this one. Right, so that one's clearly weaker, so we hope when we align it, it'll help stabilize it. So normally in a splint we would have a towel or a blanket or something. But in this case I'm not going to use it. It's more comfortable and helps stabilize it, but for this case we don't need to. Here. Can you get the triangle bandages out for me? I'm going to measure out the splint right there. I can tell it extends past the knee, so it'll stabilize the whole lower limb. So help my lovely assistant here help me take this out while I'm losing my voice. Want to use copious amounts of tape to stabilize this, because this is now what's going to stabilize the limb instead of the bone. So it's important that we give it some structural integrity. When we stabilise the wound, it should also help with his pain, and it should hopefully help his limb baselines return to normal or equal to the other side. Okay, so I'm going to can you move around to where I was so that you can get a good grip on the limb to stabilise it with the splint underneath. I'm going to try and place these triangle bandages underneath first, making sure that they're spaced apart so that they won't cover the injury, because that will hurt. Right. When you're ready, can you lift the limb for me?
Okay, ready? 3, 2, 1.
Great. Slip this under, I will voice over. I would have, when I moved the splint in, I would have asked my patient to take some deep breaths on his painkillers, because that would have been quite a painful maneuver. So now that my splint's on, I'm going to recheck my distal baselines, and can you stabilise the neck for me?
Yes.
Please. Thank you. Okay, so I'm going to check my baselines again. Check for temperature. They are a lot more equal now, although this one is still equal. I'm going to check cap refill. Still in the normal 3 seconds. And this one's now about 3 seconds as well. How's your pain now, sir?
It feels a bit better.
Okay. And if I touch your legs, does it feel the same on each side? Yep. Okay, great. Right, so I've again noticed that his arm is bleeding again. So in a real scenario, I would get my partner to apply manual pressure and elevate it. In this case, I'm going to go straight to a tourniquet. Because I'm starting to apply a tourniquet, that's quite a painful process, and once it's on, we can't, as paramedics, take it off. It's also the hospital. So I would call for backup regarding pain management for my patient. So can I have this on? So we can manage this bleeding for you. So slip it on. Thank you, then. Tighten it. I'm going to put it on a single bone limb about 10 centimetres proximal to the wound. And then you want to tighten it. Twist it until it's tight enough. Like that. Write your name on there, that's really important for the hospital. And what you want to do, you want to take the bandages off to establish that all bleeding has stopped. I'm checking that the bleeding has stopped, which it has. I'm also going to check for a pulse. In this case, when using a tourniquet, I do not want a pulse. And that pulse is dropped. In reality, I'll just cut the bandages off, but in this case, I'm not. So what I'm going to do now is I'm going to give him some longer-acting painkillers in the form of paracetamol. It comes in 2 forms, liquid and tablet. In this case, because he's in the supine position, I'm not going to use a tablet form. You might not be able to swallow it as easily, and if he chokes on it, I can't turn him on his side because of the C-spine injury, or potential C-spine injury. So sir, just so I can measure up the drug, how much do you weigh?
70 kilos.
Okay, so in this weight range, we would use about 20 mils. We would use 20 mils. So what I would do, get 20 mil syringe, draw it up, do my drug check, make sure it's in date, check it with my partner, correct dose, correct medication. Ask him to open his mouth and put it in. Make sure he swallows everything, that he's okay with swallowing 20 mils, because that can be a bit of a big mouthful, especially if you're lying on your back. So while I'm waiting for backup to arrive, I'm going to start taking my vitals. So I'm going to do first, I'm just going to take your thumb, is that alright? I'm going to do my cap refill. Right, that's about a second actually, which is quite fast. So the normal range is about 1 to 4 seconds for capillary refill. I'm going to do my blood pressure. Can I have this arm please? Lie it flat on the floor. Ow, I'm bony. In this case, you want to lie in the artery line where you estimate the brachial artery to be. On the humerus. Tightly. So, make sure you can read your gauge. Stethoscope. So, I can hear the artery. I'm going to pump it up to where I can't hear it, slightly above. Okay. And I want to register where I can stop hearing it and just start again. That'll be my systolic pressure. Normal range for systolic pressure is between 100 and 140. I'll wait until I can hear it again. So when I stop hearing it, that'll be my diastolic pressure. And the normal range for that is between 50 and 90 millimeters per mercury. Cool. So literally 160 over 80, 140 over 80, which is a very nice normal blood pressure. I'm going to take this off, check his heart rate. Just to pause here. So I'm going to count for 15 seconds and multiply it by 4, because it's measured in beats per minute. Normal range is between 60 and 100 beats. So 20 times 4 is 80, so that's 80 beats per minute. What I'm going to do now is I'm going to do his respirate. You don't want to usually tell your patient you're doing this because they change their breathing because it's the only thing they've got conscious control of. So what I might do in scenarios, I would keep listening to his pulse and I would pay attention to his breathing. 1 rise, 1 fall is 1 breath. Times that by 4 as well. The normal range for this is between 12 and 20 breaths per minute. And he's on 16 per minute. Cool. I'm going to auscultate now, which is listening for lung cells. You right if I go over the top of your shirt to just listen to your lung cell?
Yep.
Cool. Put these in. I'm going to ask you to take some breaths in and out, right? So big breath in, out, in, out, in, and out, in, and out, in, out, and in, and out. That's fine. You just want to hear normal air entry, checking for equal bilateral rising of the lungs. So to get him out of here, we would get him onto the stretcher. We would have an extra crew with us, so that'll make it a lot easier. On the way to hospital, because of what his vitals were before, because of the blood loss, we would keep an eye out that he doesn't. We would keep an eye out that he doesn't have hypovolemic shock. If we did suspect he would have this, we would keep him warm, elevate his legs, give him fluids, and some oxygen as well, and manage his pain until he's there.